Atorvastatin, or Lipitor, belongs to a group of medicines called statins. They're used to lower cholesterol if you've been diagnosed with high cholesterol. It's also taken to prevent heart disease, including heart attacks and strokes. And your doctor may even prescribe atorvastatin if you have a family history of heart disease. But in this video, I wanted to go over some side effects of atorvastatin that you should keep note of and how to manage them appropriately, and really to ensure that you're getting the most benefits from atorvastatin both safely and effectively. So you don't want to miss this. Stay tuned till the end. Hi guys, you've seen Arsenal Media Pharmacist here on YouTube, where I help you guys make better and more informed decisions about your health and wellness. So if that's something you're into, be sure to smash that like button below now. Also, you're at it, hit that subscribe button too, and don't forget to follow me on Instagram for more behind the scenes. So without further ado, let's get straight into it. Just in 2018, atorvastatin was the most commonly prescribed medication in the US, with more than 112 million prescriptions, and that's a lot of prescriptions. So if you have been on atorvastatin or are new to taking it, you might be a little confused as to why your doctor has you on this medicine and if it's really necessary. Well, to break down why doctors prescribe atorvastatin, it's important to know what it's used for and how it works in the body. So before we get into the side effects, let's tackle these two areas down first. Firstly, let's look at why it's used. Atorvastatin is used to improve cholesterol levels in people with different types of cholesterol problems. It's also used to decrease your risk for heart attack and stroke, which we mentioned earlier. And when used together with diet, weight loss, and exercise, studies show us that this helps to prevent cholesterol from building up in your arteries. This is key here because clogged arteries can block blood flow to your heart and brain, which is what this medicine is trying to work against. You see, when you have high cholesterol, a thick waxy plaque can build up in your artery walls. As plaque builds up, the artery narrows and becomes less flexible. If a blood clot forms and clogs an artery narrowed by plaque, you could have a heart attack or a stroke. Now, should atorvastatin be used as a shortcut to getting cholesterol in check? Your doctor will weigh the pros and cons of that, but generally speaking, you might be prescribed it only if you're not able to lower your cholesterol after following, number one, a low-fat diet, and number two, a program of regular exercise. Secondly, let's look at how atorvastatin works. Atorvastatin acts on the liver to slow down cholesterol making. This in turn lowers your blood cholesterol levels by lowering your low-density lipoprotein LDL or bad cholesterol and raising your high-density lipoprotein HDL or good cholesterol. And it starts to work in as little as 2 weeks. It also improves your body's ability to get rid of LDL cholesterol through your liver. And for the first 12 months on this medicine, you'll be offered a couple of routine tests to make sure your liver is working normally and that your cholesterol levels are in fact in check. Atorvastatin may also be used as part of a combination therapy with other medicines, so it's totally normal if you may need to take it with other medications. For adults, at first you can expect to take it anywhere from 10 to 20 milligrams once a day. And some patients may need to start with 40 milligrams per day too, and a dose of 10 to 20 milligrams per day is considered moderate intensity therapy with an expected LDL reduction of 30% to 50%. A dose of 40 to 80 milligrams per day is considered high intensity therapy with an expected LDL reduction of 50%. Your doctor may increase your dose as needed. However, the dose is usually not more than 80 milligrams per day. There's also some key takeaways I will leave you with, but before that, let's get into those side effects and what to do for them. Number one, muscle aches and pain. From leg spasms to muscle stiffness, mild to moderate muscle pain or myalgia is the most commonly reported side effect with statins, and 1% to 10% or 1 to 10 people out of 100 may report this effect. And although not entirely alarming, if you get unusual muscle pain, weakness, or tiredness which isn't from exercise or hard work, talk to your doctor. You may need to get a blood test to check what might be causing it, but in the meantime, you can ask your pharmacist to recommend a painkiller. However, if the muscle pain is too severe, let your doctor know as soon as you can, as this condition may be known as rhabdomyolysis, which is a very rare but serious form of muscle pain. This occurs in less than 0.1% of people and should be reported right away to prevent rapid breakdown of muscle tissue and possible kidney damage or kidney failure. Number two, headaches. No one is a fan of headaches, so if you're experiencing them when starting, make sure you rest and drink plenty of fluids and avoid excessive alcohol intake. More on this in a bit. And ask your pharmacist to recommend a painkiller. Headaches should usually go away after the first week of taking atorvastatin. Number three, cold-like symptoms. This includes things like a runny nose, sneezing, and coughing. Ask your friendly neighborhood pharmacist to see what may be the best recommendation for you and get plenty of rest. Number 4, upset stomach. This can entail constipation or diarrhea. For constipation, eat more high-fiber foods such as fresh fruit, vegetables, and cereals, and drink plenty of water. Also try to exercise more regularly. For example, going out for a daily walk or run, which will help lower cholesterol at the same time. For diarrhea, drink plenty of water to avoid dehydration. You can also look for signs of dehydration, which include peeing less than usual or having dark, strong smelling pee. Number 5. Memory issues. Researchers from Johns Hopkins Medicine looked at 41 different studies on statins to see if there was a link between taking this medication and memory loss. Combined, the studies followed 23,000 men and women with no history of memory problems for up to 25 years, which is why I put memory issues with a question mark. Despite the large amount of research showing that statins do not cause memory loss, some people may still experience this condition. So talk to your doctor if you are taking statins and experiencing trouble with memory, so they can help you rule out any other potential causes not related to statins. Number 6. Joint pain. Joint pain is considered a minor side effect of statin use, and yes, muscle pain and joint pain are separate issues in which you should bring both of them up to your doctor. There are some medications that interact with statins to increase the amount of atorvastatin that actually gets into the bloodstream and can make these side effects worse. So I left for you in the description a list of medicines that interact that you should be aware of. And yes, grapefruit juice is said to interact as well. Number 7, an increase in blood sugar. The use of statins may lead to a small increased risk of higher blood sugar levels. This is because statins appear to impair insulin sensitivity and insulin secretion. Although the exact causes are not fully known, with that said, most doctors will agree that the benefits of statins in lowering your risk of cardiovascular disease clearly outweigh any risk of development of diabetes and should not be a reason to stop taking them without your doctor's approval. If you are diabetic and taking a statin, follow your normal blood sugar readings protocols and let your doctor know if anything out of the ordinary pops up. Sometimes statins may not be the best treatment for patients, as the side effects can be too troublesome on a daily basis, which is why it may be necessary to bring up the use of the alternative PCSK9 inhibitors to your doctor to see if that may be a better solution in managing cholesterol without all the statin side effects. That's just something to keep note of. With being aware of those side effects, I want to share with you 2 important times for when you should contact your doctor. Number 1, dark brown urine resembling the color of Coca-Cola. Severe muscle weakness or pain, fever, tiredness, these are all signs of rhabdomyolysis. And number 2, yelling of the eyes or skin or pale stool. These are all signs of severe liver issues, as well as any other allergic reactions, including swelling of the face, lips, tongue, and or throat that may cause difficulty in breathing or swallowing. And lastly, to end this video, I want to share with you 4 important key takeaways that pharmacists tell patients at the pharmacy. Number 1, atorvastatin stays in your body longer than other statins, so it can be taken either day or night with or without food, whichever time you remember best taking it. Number 2, atorvastatin isn't recommended during pregnancy or breastfeeding, as there's no firm evidence that it's safe to use. It's best to stop taking atorvastatin at least 3 months before you start trying for a baby. Same thing goes for breastfeeding. You do not want to be taking it during breastfeeding, as it's not known if atorvastatin actually gets into the breast milk. But let your doctor know right away before stopping. Number 3, limit alcohol intake. Consider limiting your alcohol intake because statins plus excessive alcohol may raise your triglyceride levels and possibly lead to liver toxicity. If you drink more than 2 glasses of alcohol per day, discuss this with your doctor. Number 4, do not take other medicines unless they have been discussed with your doctor. And yes, this includes vitamins and herbals, St. John's wort being one of them. Overall, atorvastatin has been shown to help prevent heart attacks and stroke, especially in cases where those health issues are inherited. But statins are not the only way to reduce cholesterol. Simple changes in your diet and an increase in exercise can make a difference, and it should not be underestimated. And that's it, guys. I hope this video helps you, give you a better understanding of atorvastatin. Although this isn't everything there is to know about it, I hope that this is a good starting point. I also hope that this video was insightful to you guys. The only thing I ask in return is just a simple like down below for the YouTube algorithm. Thanks for sticking tuned all the way till the end, and as always, I'll see you guys on the next one.